Hi, my name is Courtney Scarano, and this is my DB2 video for HSC340. Part A, Client. Hi, my name is Patty. I'm 40 years old, and I am of an average height and weight for a female at 5'5" and 138 pounds. I take regular walks with my dog daily and consider myself to be an overall healthy woman. However, I recently completed a health risk assessment form and decided to make some changes to my health behaviors, specifically in regard to my sugar intake. I recently went in for my yearly physical, and my doctor was slightly concerned with my elevated blood glucose levels. He wasn't super concerned and just advised me to watch my diet. I haven't really thought much about the issue again until the question was brought up on my HRA and I had to input my fasting blood glucose level of 115 milligrams per deciliter. This question triggers my desire to change my snacking behaviors. I have always had a sweet tooth, but I've been able to manage it up until recently. In thinking back, I've increased my consumption of cookies and chocolate specifically. Seeing the diabetes box on the form triggered these thoughts of change as well, because I don't want to end up having to check that box on future health assessments that I am diabetic. It was at this moment that I decided I want to regain control and stop diabetes in its tracks before it develops fully, but I'm not really sure how to do this. I've since done a little research and determined that I am in the contemplation stage of change because I don't really have a plan of action to move me into the action stage just yet, but I'm determined to discover the tools and processes to help me achieve my goal. I recall a couple of friends suggesting a food journal tracking app for my phone to raise my level of consciousness regarding how many grams of sugar I'm consuming, so I think downloading maybe this app would be a good first step to success. I have also decided that implementing helping relationships, such as with a health coach or maybe a nutritionist, is going to be helpful in directing me towards my goal to lower my blood glucose level back down to a normal range. Finally, I can also use counter conditioning to substitute sugary cookies for dessert with healthier options such as fruit. The best possible outcome for this behavior change is a lower fasting blood glucose level at my follow-up doctor's appointment and movement into the maintenance stage of my behavior change. I am prepared to face challenges along the way, and I know this will test my self-efficacy upon movement into the maintenance stage. I just hope I can stay confident that I can cope with future situations where there is high temptation for me to give in to these sugary treats. Part B, Health Coach. Hi, Patty. My name is Courtney. It's a pleasure to meet you. I'm happy you've decided to take a step towards improving your health behaviors. Congratulations. You've already completed the first step of your journey. I understand you're in the contemplation stage of change to prevent diabetes with your desire to dramatically reduce your sugar intake. So far, you're on the right track with brainstorming ways you can progress along the path of change. Helping relationships will be an important piece of this for you, and considering you've already started by contacting me to work with you, you're already on the right track to success. Now that you have me on your team, let's look at some other ways you can step into the action stage. You mentioned using an app on your phone. Do you have your phone with you? Let's download MyFitnessPal so you can get started with a food diary where you can track what you eat, so at the end of the day you can compare your consumed grams of sugar versus the target goal that we set for you together. This will help hold you accountable by providing you with that raised level of consciousness you mentioned you need to help you move along the model of change. Once we get you moving into that action stage for a few months, at least 6 months, we can award you with the next stage called the maintenance stage. This is not where the challenge ends, however, but can become a little bit more challenging. But it's important for us to recognize these challenges before you're faced with them so you're better prepared and you can breeze right through it. I recalled you mentioned a test of your self-efficacy in tempting situations. If you believe you have the ability to control your own choices, you can use this internal locus of control to your advantage and remain on your path of behavior change. For example, you're at a birthday party, which is an environment out of your control because, trust me, there will be cake. However, you have two choices. You eat the cake, or you believe in your ability to resist the birthday cake and challenge your self-efficacy, which you have proven is strong at this point because you are knowledgeable about what it takes to accomplish your ultimate goal of lowering your blood glucose level and preventing diabetes. I am confident in your ability, but you need to also be, and that's where me and your food journal and supportive family and friends who are aware of the changes that you're trying to make can come into play and give you the tools to be confident in the process of change, as well as carry you through to the maintenance stage that you desire to get to. With the expectations you have set for yourself and the beliefs you have in your ability to make this change, you are on the path to success in preventing diabetes by lowering your blood glucose level. I believe in you, but you need to also. Thank you. I hope this helps you.